All right, so some of the clients that come in may have pre-existing conditions, or they may have considerations that you need to build into your workout plan for them. So one of those is high blood pressure, also referred to as hypertension. So that is generally considered to be any blood pressure reading that is greater than 120 over 80. So now, if somebody is hypertensive, um, their workout does need to be reduced, I guess, or managed so that they don't elevate that already high blood pressure further. This is particularly true if when they're working out they start to experience severe shortness of breath, dizziness, any pain in the shoulders or jaw. Um, Certainly, if they were to push their blood pressure too high, they run the risk of things like a heart attack or a stroke from occurring. Now, there's certain types of exercises in terms of strength training that you wouldn't prescribe for someone with hypertension. And that can be some of your isometric exercises, for example, where a weight, say, is held out in front and it's held there for an amount of time. Other exercises that sort of involve a change in body height, so something like a burpee, where there's a rapid drop down and then a push back up, or work that sees the weight taken over the head. In terms of the total weight lifted, you'd probably want to reduce that as well, just so that the body isn't being pushed too high in the workout zone. Now, in terms of cardio training, high intensity interval training would more or less be off the menu. You'd want something that would elevate their cardiovascular system, but maybe to a lesser extent, so work to a lesser percentage of their maximum, but for a longer period of time. You'd sort of be looking for 30-minute intervals of training, anything up to about 5 times per week would be ideal. If they are hypertensive, it's also worth getting consent from their GP before they undertake any of the fitness training programs you prescribe.